Welcome to Neutral Voices. I'm Dr. V, and this is a brand new show, Your Mental Health Matters. And we're here with some beautiful ladies. Ladies, let's talk about it.
All right.
Let's talk about it. You know, this is the jump off for this show.
Yes.
So I'm excited to be here with you. Will you please introduce yourself to your new audience?
Yes, hi. My name is Robin Crawford, and I'm a licensed mental health counselor. Also, I'm CSA certified for the state of Indiana. I also just recently received a PSI training and became a certified clinical anxiety professional, as well as a certified telemental health. I know that's a lot of little credentials behind that, but really I'm an empathetic counselor, and I'm here to, with these lovely ladies as a member of the Society of Black Mental Health Professionals, to reach out to the community and answer any questions that anyone may have with regard to mental health. So I'm just excited to be here, and I look forward to talking with all of you.
Nice.
My name is Crystal Kelly. I'm a licensed mental health professional here in the state of Indiana. I've been in the field for about 13 years. My passion is mental health and educating our community about mental health. I am the president of the Society of Black Mental Health Professionals. Our mission statement is to educate, inform, and empower our people when it comes to mental health. And I'm excited to be here for our first show.
Nice.
My name is Tamara Files, and I'm a registered nurse as well as a licensed mental health associate. I am glad to be here with these other ladies, Miss Crystal, Miss Robin, and my specialty is focusing on whole health, spiritual, mental, physical, and emotional health, and I represent the CM Heart to Soul LLC with life coaching and consulting. Thank you.
Awesome, ladies. Well, welcome. I'm so excited for you and this journey. Tonight's topic is therapy and everything about therapy. I know you're going to go into some different angles. I know we talked before the show, and we talked about how there's two sides to therapy. So we're going to get into therapy and how it applies to us on a regular basis. So my first question to you is for normal people, and I have to say that way because we sometimes we look at ourselves as normal, and a lot of times maybe we're not so normal. So looking at the two different types of people that may need a therapist, let's talk about the difference in the therapy that you guys would recommend for different people. So the normal people or people that may have something that they're born with or some type of traumatic situation that has happened to them that has caused them to be in a different state of mind. Yeah. So talk about the different types of therapy.
Okay. You want to go? I'll go ahead. Yep. So I believe what Ms. V is talking about, you have your everyday stressors from family life to work life and what have you. And I believe everybody goes through those moments of, lows and highs, depression. And then there's the individuals that may have genetic predispositions that may need to seek professional help. Yeah. And that will require a therapist.
Yes, and I love that because this is definitely your field, not mine. So I love how you put that genetic predisposition. All right. Okay, we're going to learn some stuff.
Meaning some of the things that they may not be able to control.
Exactly.
Something or an imbalance in their brain chemicals and what have you. And unfortunately, those are things that they cannot control without the help of medication and or therapy.
Right. And then even when you say that, a lot of times the normal people, we need meds and we're taking different meds so that we can cope from day to day.
Right.
And so I would say, I would love to say that we don't need it, but some people feel like they can't function from day to day without something.
And that's okay. We have to normalize that. That's okay if you can't get out of bed and you can't go to school. Then if you need to take your psychotropic medications, then you do that. And that's why we want to really educate to help remove that stigma of medication and therapy.
Nice. Yeah. And you said stigma, and there is a stigma connected to that.
Especially in the Black community.
Yeah. Exactly.
And I think that's our main focus of being a part of this. and we are all glad to be here and a part of it. And with the stigma, we know that a lot of times we don't see faces like ours, and therefore people are reluctant to get help.
Yeah.
And we're trying to change that disparity as well to get people more encouraged to go into the profession, and then also encouraging potential clients to come and seek therapy without having that over their heads.
Yes. I would say that that's a challenge. Crystal, did you want to speak to the first?
Yeah, I want to
question?
also say when it comes to people seeking help, like normal people, pay attention to your functioning. Like you guys had said before, if you're not able to sleep, if you're not able to go to school, if you're not able to get along with people, relationships, all that has an impact. So being able to recognize that and say, you know what, maybe I do need to talk to somebody professionally. Another way to kind of go about it is if you have a provider,
Right.
going to your doctor, a lot of times they'll ask you those depression screen questions. If they see that you meet criteria, they will, say, hey, here's a list of therapists that I think might be a good fit. So that's a great way to go about seeking that help as well as through your provider.
And I guess we have to kind of mention the fact that sometimes life challenges and life changes will put us into that. Whether it's a loss of a loved one,
Yes.
whether it's a traumatic event,
Yeah.
and we'll go deeper into those conversations, in the coming weeks. But traumatic events is a big one because what I've seen, young people that experience traumatic events, and a lot of times the adults, and we talked about this before, a lot of times the adults will say, oh, they'll get over it. And that's not the case all the time. So we have to pay attention to that, especially with the kids, because they're not going to come out and tell you, oh, I'm depressed, because they
Right.
don't know that.
Absolutely.
But in their behaviors, you'll see
Yes.
some of the changes.
Yes. And so when you talk about the kids, and let's just say kids, children of all ages, let's look at the school system and therapy and the lack of therapy in the school systems. How do you guys feel about that?
It's so needed.
Well, yeah, and those adverse childhood experiences, the ACEs that they use to assess children.
Yeah.
Well, they realize now that the importance of having clinical mental health counselors in the schools. It used to just be, just school counselors and so forth. But now they see the importance of that, and really, a lot of I don't know the numbers, but Fort Wayne Community Schools now have a lot of therapists now in the building,
Especially in the
working along.
elementary.
Yeah, right.
Elementary
Right.
part. Yeah.
And we have a member of the society that's in the school that works at I forget which school she works at, but she's in there now working. So so they see the importance of it. And one thing we want to keep in mind, even though all of us may have, when we're assessed with that ACEs, all of us may have some numbers after they, go through the list. But one thing we want to encourage people to remember that, research has shown, because of neuroplasticity, and we're going to be talking about that, shows now that goes on throughout life, and it can change the brain. So that gives everyone hope that just because you've had some adverse experiences
That's
as
right.
a child doesn't mean that I'm going to be a sore loser when
That's
I grow up,
right.
or I'm doomed. No, it does not.
That's
So
right.
that gives people hope, and we'll be talking about that further.
And we mentioned bullying too.
Yes,
Sorry,
Yes.
that's
since
right.
you were talking about school.
That's right.
So that again is a big topic in the community. Not just locally but nationally. Kids being bullied and not really knowing how to handle, adverse traumas from their peers at home and what have you. So bullying will be a big topic that we're going to go into further, and how kids can have better coping skills of dealing with that
Absolutely.
and not let it be an end all for their behavior.
Yes. And I know one of the things we say a lot is protect your mind. So let's talk about mind nutrition. So we can say that, but what does that look like? How do we protect our mind, and what things do we need to do on a daily basis? It makes me think about Proverbs when it says, as a man thinketh in his heart, so is he. And so whatever you're thinking on the inside shows on the outside. So what things can we do for ourselves to help our mental nutrition?
Yeah. So it starts, like you said, with the mind. It starts with those thoughts. So if you're constantly having irrational thoughts, negative thoughts, just imagine how emotionally that's going to make you feel. More depressed, more anxious, more irritable, more, whatever when it comes to those irrational thoughts. So being intentional by paying attention, like, okay, if I'm having these particular thoughts, listen to your body. Your body's going to let you know how you're feeling. So you might notice your muscles are tightening up a little bit more. You getting headaches, not sleeping well, stomach upset. So it's all about being self-aware. Self-awareness is a beautiful thing once you get a hang of it, but you got to be intentional about it.
And another thing is just generally nutrition.
Yeah.
What we eat, being physically active on a regular basis, and is recommended, I don't know the exact number, but at least most of the week, 4 times a week, at least 30 minutes for the exercise. And that kicks off, feel good.
Yeah.
Endorphins.
Yes.
Feel good emotions, and that kind of boosts your mood. And then also our nutrition, what we eat, what we drink, particularly refreshing our bodies with water. I know a lot of people don't like to just drink water, but we have to understand that most of our body, more than 70% of our body is made of water, including the brain. And that just kind of regenerates and get those toxic elements out of there. And let's say exercise, nutrition, and self-care, which is a part of that, and being mindful of taking your time to rejuvenate yourself. And then as adults, we need to make sure the kids are getting those things as well.
And proper rest, because I can
Rest.
tell
That's
you.
what I was trying to think.
Okay, I was going to say, I can tell you, I'm thinking
what I
about
was thinking.
myself right now. And I'm thinking, well, I'm just saying one of the things that is so hard for me. And so I don't know how to shut my brain off because I'm constantly planning and thinking. And, even when I'm in the bed and I'm trying to go to sleep, but it's like my mind continues to
And
plan.
we have to dig into that deeper now.
Yes.
Maybe not today.
Okay.
But we do need to have a cutoff time for ourselves, for the kids.
Yes.
At a certain time, all electronic devices need to be shut off because you do need that time to kind of wind down and relax your mind. Because if you're always stimulated, you're just going to be on 10 all the time, even through the night.
Okay, so and especially when you're sleeping with the TV on.
Right.
I would imagine.
No, that's not good.
Take the TV out of the bedroom.
Nope. So just improving that sleep hygiene.
Right.
So being able to have some type of routine that you follow at night will help with your mental health as well.
And it's important to note that teenagers need more sleep than the younger kids because they're going through a major change, body change, and they need more sleep, at least 10 hours. I know they don't get it because everybody's tied to those devices. But parents and caregivers, you need to be mindful of that so they can rejuvenate those brain cells to have better mental health.
Isn't that something when you say parents? So parents are guilty. I'm sorry. I'm not a parent, so I can say this because I had a parent. I got a parent right now. But parents will kick the door in on a Saturday morning.
Clean up.
Get up. Why?
Early. Yes.
I'm saying, what? Right. The pine saw and whatever's going on. But couldn't they actually sleep in a little bit? Probably wake up in a better mood and then get up and do those same chores that you waking them up out of their sleep to do.
I have a suggestion. It's not the end all. I would suggest do some of your chores on Thursday night. Do some on Friday night. So you can sleep in a little bit longer and finish them up.
I like that. That's for the children.
There you go.
Okay.
But self-care.
Yes. Self-care.
Yes. Did anybody else want to say something right there?
No.
Okay.
I just agree with everybody. That's all of that.
Okay.
What you're saying, the sleep hygiene.
Yeah.
We're going to be talking about the brain a little bit more. You're going to give that amygdala. That's part of that brain. You're going to give that a new experience. So we're going to keep educating everyone on that brain. That's important to learn that. That helps too. Learning about the brain is what helps reduce
that's the foundation.
anxiety.
Yes, that's good. That's amazing because with you saying that, you just talked about something that most people definitely cannot spell, amygdala. And so I've heard about it in school because I teach at the school system. So they talk about that quite a bit and neurons and different things. And so so that brings me to this: how do we reset our mind? And so you kind of touched on it a little bit, but and then with that question, take that into the plans that you guys have with this particular platform.
So so what we want to do is be able to educate. We want to be able to expand on a lot of different topics when it comes to what you had said, Ms. Robin, about the brain, healthy coping mechanisms, healthy coping skills, being able to educate people about different mental health illnesses. It's just a matter of just getting people informed, and this is what this platform is going to be about.
Okay. And
Oh, I was just going to add, yes, we are here for the platform for the
Yes.
education and information. And I don't know about the other two, but I guess I will say the disclaimer: we're not here to be the therapist, so to speak, for the audience.
Right.
We're
right.
encouraging you to go out and seek the therapy, and hopefully giving you enough information to dig into that and be encouraged to go seek the therapy outside of the conversations that we're having.
Right.
that's good. So with that, do you find it's easier for women to seek help and to seek a therapist versus a man? What do you think about that?
Yeah. Well, I have a lot of women on my caseload. I have a lot of women who feel comfortable talking about their emotions versus a guy. I'm not saying that there's no guys that I don't have on my caseload, but the majority are women.
Majority are women. Or couples.
Or couples, yeah.
Okay.
And you say that, and the topic of men feeling like they're weak if they go to seek therapy, and we think that comes from, as children, they're told to man up, stop crying, and that is probably their stigma. So hopefully we'll start changing the numbers with that, because even as a grown person, we go through different things in life, and at times we need help with that. And what I've also noticed is that women tend to have their circle, family or girlfriends or what have you, and then they tend to talk about their emotions that way. However, that doesn't negate the fact that they could also go and seek therapy.
Yes. Since the topic is therapy, I have to mention the field that I am in, which is the beauty industry. We are therapists in a certain type of way. And so since we're talking about men, and then let's bring, to the forefront that June is Men Wellness Awareness Month. And so the barbershop, I would say, is a therapeutic environment for men to release. And then so I have to say this one thing that's true. And so female barbers don't get me. But that is one reason why I think that female barbers should be in a different barber zone. Because with that female in the room, it changes that conversation. And, the things that they would talk about and be able to release to help them deal and cope with everyday life. So I just wanted, so I'm definitely not on y'all level now, so I haven't been trained, but I tell you, I've had some people sit in my chair and share some things. And and you just wouldn't believe the things that somebody would feel comfortable to share with their stylist or barber, nail tech, etc. People in the beauty industry. So with that, I would like for you guys to say who you are again, and let the people know when, where, how this is going to flow from here on out, how often you'll be with them, and so that they can be sure to tune in.
Okay. Well, all right. I'm Robin Crawford, and I hope to be here as much as I can. I just want to mention, too, that as far as helping out the community, I also am the owner and therapist of Ginger and the Roo, and that's a affordable, self-pay, private mental health counseling place where you can come to. You can Google that. And I want to also make sure I put that out there to contribute toward the community, because that's the problem we're finding, too, that a lot of African Americans, they don't have insurance and they can't afford it. So I've created that platform, or that therapy, that private therapy practice for you all. And like I said, I'm just going to look forward to being here as much as I can. I'm very, very busy, as we all are, but I'm going to try to be here as much as I can to help out and give back to the community.
All right.
My name is Crystal Kelly again. I'm a licensed mental health counselor. Been in the field for 13 years. So, yes, I want everybody to be able to tune in to our podcast. This is going to be something special. This is something that's going to be different. This is something that we'll be offering to the community. So please be able to tune in every other Friday of each month at 8:30. We're online. We're on Facebook. We're on Spotify. We're on YouTube. So we are here for you guys. And we just want you guys to know that it's okay to ask for help. And so once we get this platform up and going, we'll have special guests. We'll have call-ins. And so just please be looking out for us every other Friday at 8:30. We're going to be here for you guys, and we're just excited for what's to come.
Yes. Awesome.
Thank you, Krista.
Yes.
And I am Tamara Files, again, licensed mental health counselor associate and a registered nurse. And I'm representing CM Heart to Soul as well as the panel here. CM Heart to Soul, where there is affordable
Yes.
care. I don't like the word therapy, but there is affordable care, and we focus on the whole health, spiritual, mental, emotional, and physical. I am also glad to be here and looking forward to having a conversation with you and serving my community. Thank you.
Awesome. Thank you, ladies, for being with us. And I'm Dr. V. This is Neutral Voices, and this is Your Mental Health Matters. Let's talk about it. We will see you next time. Thanks for hanging with us.
Thank
Good
you.
night.